Safety measures to prevent or reduce crisis in healthcare. 1.0 Introduction. The management of assaultive behavior in healthcare facility involves promoting the safety of patients, healthcare professionals and visitors. This chapter will discuss general and personal safety measures in the healthcare facility. 2.0 General safety measures for the healthcare professionals. General safety measures for healthcare professionals facilitate sustenance of a good working environment and prevention of assaultive behavior. The safety measures should be adjusted according to specific conditions or nature of environment that healthcare professionals work in. General safety measures consist of 5 elements: administration and healthcare 2. Professional support 3. Environmental analysis 4. Risk reduction 5. Training and regular review. 2.1 Administration and healthcare professional support. The healthcare administration and the facility employees must engage in safety plans. The plans involve appointing teams of healthcare workers, employers, committees and representatives of the safety plans. The healthcare professionals who are experts in crisis management should be involved. This can include the quality control department to set standards and the education department to train the employees. The representation should be fair in terms of departments and shifts. Drills should be conducted for workers in the different shifts. i.e. drills should be conducted for the night shift workers, morning shift workers and mid-shift workers, so that everyone is equipped with knowledge of early recognition and appropriate intervention of assaultive behaviors. Tasks should be allocated to the different stakeholders who may include, employer's representative, healthcare professionals, security representatives and administrators. Healthcare professionals able to deal with head injury, substance abuse, psychiatry and dementia should be advised to assist when the need arises. A working structure and applicable policies can be designed. The policies should represent diverse needs of the departments and provide procedures to be used in case of crisis. The safety plan should take into consideration the physical, psychological and emotional safety and health of the healthcare professionals. A balance between the safety and health needs of a healthcare professional, patient or visitor should be recommended. Representatives, experts, committees and teams with assigned tasks or responsibilities should inquire and understand their responsibility in full detail. The healthcare professionals ought to be committed to comply with the policies and give feedback. Suggestions on safety and complaints should be given the appropriate authority. Cases of crisis should be reported in time and appropriately, and affected individuals receive treatment per facility policies. 2.2 Environmental analysis. Environmental analysis will consist of an assessment where potential risks are identified. Procedures, threats and factors that could result in unwanted situations are pointed out. The analysis will take into consideration incidents and history of assaultive behavior in the same and other healthcare facilities. The information could be retrieved from compensation claims and patient records. Environmental analysis in the workplace focuses on records, surveys and security details. The records will give details of occurrence of incidents in various departments, healthcare professionals by title, time, activities in progress and frequency of occurrence. The incidents are analyzed and compared with similar reports from other healthcare facilities. Surveys taken from healthcare professionals can be a source of information. The surveys can assist in determining procedures that lead to risks, inadequate measures, inadequate resources, failures, policies and activities that need to be changed. Characteristics of those involved in the assaultive behavior and recommendations are considered. Risky procedures and locations should be identified. Some of the factors may involve physical conditions like the layout of the hospital facility, isolated locations, lack of communication, security problems and inadequate light that contribute to risk. 2.3 Risk reduction. Risk can be reduced by adopting measures, procedures and administrative work that will assist in preventing and controlling the occurrence of assaultive behavior in the health facility. The administration should make physical changes to the environment. The changes may consist of adequate lighting in dark rooms and increased space where necessary. There should be light both inside and outside the healthcare facility. Alarm system and panic buttons can be installed so that a potential victim can obtain assistance. The phones and radio systems should be working at all times and reliable. The waiting room should be made comfortable with chairs and reading materials. The furniture should be placed properly to avoid falls. The number of furniture in the consultation room and activity room should be limited. The furniture should not be fixed or possess sharp ends. Avoid placing vases, pictures or trays where they are visible or in high-risk areas. The healthcare professionals will require different washrooms from the patients installed with locks. Broken furniture, bulbs, windows and locks should be replaced. Thorough searching of mental health patients during admission must be done to prevent smuggling tiny weapons like razor blades, needles, tiny pocket knives, etc. Every pocket comb must be completely examined, as some pocket combs, when unfolded, are pocket knives. Patients must account for their toothbrushes, as some mental health patients break their brushes and use them as weapons. 2.4 Training, Mason and Chandley, 1999, p. 65, educates that training provides understanding on assaultive behavior, and enables the healthcare professionals to prevent and handle impending crisis appropriately. Training educates the healthcare professional on policies concerning assaultive behavior in the healthcare facility. Additionally, the healthcare professionals will be able to recognize risks, escalating behavior, warning signs, prevention methods, and what to do in the case of a crisis. They will know where to report and how to report an unpleasant incident. Additional information about cultural diversity, personality differences and various ailments that contribute to assaultive behavior can be shared. Flannery, 1998, p. 91. They will also know how to complain or itemize concerns, where to complain and how to get compensation. Training should be given to healthcare professionals, managers, supervisors, security workers, and other hospital workers. 2.5 Regular review. Records of assaultive behavior should be made. Most facilities call it the incident report. The record should be analyzed to give information on risk factors and patterns of assault. An analysis will provide a basis for identifying gaps that can be made to manage assaultive behavior in the healthcare facility. Important items for record include type of injury, number of incidents, assault, threat, accidents, type of crisis, response to crisis, persons involved, identified problem and solutions. 3.0 Personal safety measures. Healthcare professionals should assume responsibility for their individual safety. They need to protect self from possible aggressive behavior coming from patients, visitors and other healthcare professionals. This can be achieved through education and training, which is the reason for this textbook, self-defense mechanisms, de-escalating violence, being alert and practicing extreme environmental awareness. Healthcare workers should take their breaks in protected rooms that the patients do not have access to. There was a case of a nurse on duty who was supposed to be watching a patient on a one-to-one observation to prevent suicide. Unfortunately, the nurse slept off. The patient beat the nurse so bad that by the time the other workers could arrive, she was already unconscious. She was rushed to the emergency room and suffered paralysis from spinal cord injury inflicted by the patient. 3.1 Education and training. As healthcare professionals engage in ongoing training, the employee will assist in raising the awareness of the trigger factors. Employees will understand safety strategies and techniques for conducting self at work. Training will educate the healthcare professionals on the techniques for de-escalating violence. Bibby, 1995, p. 56, found out that education gives the healthcare professional the ability to predict behavior and adjust to being neutral in the diffusion of anger. The healthcare professionals should cooperate with the organization when asked to join in programs. The policies concerning the working environment should be followed. All incidents should be reported to the appropriate authorities so that appropriate measures are taken to prevent further assaultive incidents. The healthcare facility puts a lot of effort in the prevention and management of crisis. 3.2 Self-defense mechanisms. A professional healthcare worker can practice safety by adapting appropriated behavior and choosing to defend self in the case of a physical assault. When at risk, they can call for assistance, keep the way clear and escape if possible. Practice patience and encourage conversation. Avoid showing the aggressive person the back, as the aggressor can try to choke from the back and get away. Another way of protecting self is by choking the aggressor from the front if they attack from the front. If the attacker grabs the arm, try to push the arms downwards, then twist towards the escape route. Personal safety measures require a healthcare professional to avoid working in isolation where there are patients with assaultive behavior. 3.3 Ways of de-escalating violence for personal protection. A healthcare professional can bargain and apply conflict resolution when facing a possible crisis. Conversations should be conducted in a calm environment with the worker listening to the person in crisis. Confrontation should be avoided. Keep away from persistent contact of the eyes. It is wise to stay away from interacting and request for audience. Showing empathy, understanding and showing concern to the assaultive person can reduce tension. Healthcare professionals can use moderate tone, calm voice and appropriate choice of words when communicating. Redirecting the topic can be another significant method of de-escalating assaultive behavior. Refrain from responding to threats with other threats since it can activate violence. An example is an incident where a mental health patient told a nurse that she should be ashamed of herself because all she does is come to the hospital to give meds to make a living. The nurse replied her that she should be more ashamed that her teenage mates are in college, working, or at least doing something with their lives, but she is living in the hospital. The patient reacted in a way that was very notable. There was a code gray. When the root of the behavior was researched, the nurse gave the story. Avoid commanding and when given a chance acknowledge their feelings. Evade walking close, jumping, touching or moving closely to the person with signs of aggression. Avoid touching objects that could be perceived as a weapon. Communicate when you want to move or touch them by making them understand your purpose. The healthcare professional can request for permission before dressing a wound, changing beddings, taking temperature or recording blood pressure, when conducting medical procedures. Scott et al. 2001, p. 61. 3.4 Be alert. The healthcare professional should be very alert, taking precaution when a threat of aggressiveness is imminent. They should enact a safety plan without delay if a patient is assaultive. If the healthcare professionals are threatened, they should avoid using suggestive body language and words that may reveal their feelings to the patient. If the patients detect a threat, they may withhold information, feel threatened and react negatively to the healthcare provider's instructions. Hamilton 2011, p. 1. According to Hughes, 2008, p. 39, the healthcare professionals should be able to recognize risks and signs that can lead to aggressive behavior. Nurses and other healthcare workers should recognize signs of assaultive behavior. When a person shows frustration, anger and physical gestures depicting aggression, they can be viewed as a threat. Recognize patients with conditions that cause aggression such as mental illness and head injury. Remain alert at all times because every situation is unique and should be handled depending on the circumstances. Healthcare professionals should analyze the situation and type of occurrence before attending to the patient. Exercise vigilance when dealing with the patient. 3.5 Self-care for healthcare professional. Healthcare professionals may become busy and fail to take care of their needs, which can contribute to emotional outbursts. With the knowledge of their working environment and challenges, healthcare workers should take care of their emotional, physical and psychological needs. The healthcare professionals should regulate the number of hours in a day so that they are not overworked. After work they should rest and get enough sleep. It is very ironical how healthcare professionals preach so much about rest but rarely observe it. They are many a time ruled by the amount of money they will make when they work overtimes. Lack of time for oneself can predispose to lack of mental alertness when assaultive behavior is imminent. Evade situation that can cause burnout and fatigue. Healthcare professionals can manage stress by performing hypnosis techniques. The healthcare professionals should take a balanced diet and have regular physical exercises. They can maintain social relations with family and friends for social support. Healthcare professionals should maintain their spiritual relations and stay proactive. National Collaborating Center for Nursing and Supportive Care, 2005 p. 1. 4.0 Conclusion. General and personal safety measures facilitate prevention and intervention of aggressive behavior. Healthcare facility administration and healthcare professionals are required to collaborate in the development plan of policies and intervention of violent behavior. After developing a plan, the selected teams, commissioners and representatives analyze the environment to identify the risk factors. The healthcare facility together with professionals commit themselves to strategies that help in reducing risks that could contribute to crisis. Healthcare employees are trained on the safety measures, warning signs and intervention. Once the plans are implemented, they are reviewed regularly and adjusted accordingly. General safety measures require improvement of the physical environment, improved working relations with patients and other healthcare employees, participation in implementation plan and reporting incidents correctly to the right authorities. Personal safety measures encourage healthcare professionals to ensure they receive training and competence in assaultive behavior prevention and management.